Different parts of the eyes are affected by different problems. So I'll give you an example. If, for example, you've got red eyes or itching eyes or pink eye, that normally affects the front part of the eye. So the front part of the eye actually has got a plastic. That plastic is transparent, it's thin, and it's flat. The purpose of that plastic is to protect our eyes. So for example, if you're walking in a dusty area, then something comes into your eye. As soon as it lands in your eye, then because of the nerves on that plastic, then you can feel, or there's something in my eye. You're going to respond to that. So the myth that people normally have is that if you take a child's urine, you put it in your eye, or you boil a few tea bags and make some herbal mixture, it's going to help cure the redness or to remove whatever is in your eye. Some myth is that you mix water and salt and then it's going to clear your eyes from the redness or remove whatever is affecting that part of your eye. Those, unfortunately, are myths and they do not work well with the eye. Remember, the eye is like your skin. It's just as sensitive. If you pour a chemical on your skin, it might burn you. If you pour hot water on your skin, it might burn you. So the eye, we also use and follow the same concept. Any chemical mixture or any form of urine concoction or herbal mixture is going to damage that plastic. So we normally ask that should anything come into your eye, rather use normal tap water, without soap, without bleach, without any herbal mixture, without bleach, without Dettol, because they themselves have chemicals and they're going to burn the plastic. Most people assume that we as optometrists, by looking at your eyes, we can actually tell what the eye problem is. Unfortunately, that's not the case. But I'd also like to emphasize that your lifestyle contributes more to you needing an eye test or not. For example, if you've got hypertension, if you are diabetic, if you're a smoker, you play sports, or you work and you're exposed to the sun on a daily basis, or if you're using the computer and experiencing headaches, those are things which should actually motivate you or encourage you to say, let me get my eyes tested to check if I'm still okay. So this is one of the machines we use to do our eye test. Normally you move it closer to your patient, make a few adjustments. I'm going to lift her up in her chair. Then I'm adjusting it so that it aligns with the patient's face. Are you comfortable?
Yes, I am.
Okay, then I'm going to lock it into place. Right. Now this machine has got different lenses for us to be able to test the eye individually, like the left eye and the right eye, and to also see different structures of the eye, but only up to the lens on the inside. So normally we add a special lens, which is going to allow me to check her eyes, or the lens to be specific, and to read the prescription of her lens. This is the part of the test where we determine which lenses are we going to give you. Those lenses being those which are going to help you check if you are short-sighted or far-sighted, or if you've got age-related reading problems. This is only for one part of the eye. We normally do this in the dark, where we give the patient a target. For example, she'll be looking there at the first letter on the chart, which is the biggest E. Then we switch off all the lights and then I have a look at her lens on the inside. Now that I've already established the prescription of the patient for both the left and the right eyes, this part of the test is done. So with this, I know which lenses she's going to need to help her see better at far and at near. So this part of the test is done. Then we move it. And then now, we normally move to this part, or to using this machine. In cases where your patient has an obstruction on the eye, but you're not sure on which part of the eye the obstruction is. Remember I said the eye has got different layers. So this is the slit lamp. This is what we use to view different parts of the eye in 3 dimensions. So that's the beauty of the eye. But normally, should there be no obstruction, from when you are generally checking the patient's eye, you just stick to using this. This is called an ophthalmoscopy. It still helps you to see those layers, but now this is only in 2 dimensions, not 3 dimensions. So this as well is a test which is done in the dark. This mobile case here is similar to the machine here. It's just that the machine is more advanced. But with this case, you are able to determine the patient's prescription as well. It's best used for the elderly patients as well as for the youth or the children, if I may say so myself, because now with this, they are more comfortable. They still have a view of what's happening around them, and they'll be more settled as to compare to using this machine over here. So this is when you want to get a detailed view of the patient's eye to actually get the prescription which they need for their classes. So this is more of the mobile unit. As part of our social responsibility at Eyewear Optometrist, this June we would love to give away 16 pairs of spectacles to the needy. The needy, there's no specific criteria. It could be the elderly, it could be school-going children, it could be anyone who's unfortunate and cannot afford a pair of spectacles.